Good morning. I'm Dr. Sumera from the Department of Medicine, Faculty of Medicine and Health Sciences of the University of Mauritius. My project advisor is Professor Mona Al-Sheikh. My project is about the development and implementation of a portfolio for undergraduate medical students. So what was the problem that we addressed? Due to the busy schedule of the practicing physicians at the hospitals, the students only sometimes are attended to, and that's to their detriment. The hospital clinicians are also sometimes acquainted with teaching and supervising students on their placements. Additionally, there's a high student-patient ratio. Since prospective clinical doctors under training, they must be competent in clinical decision-making skills to serve the country's healthcare system and be safe doctors. Therefore, a reflective portfolio was used to provide a means for the students to learn through reflecting on their experiences and to obtain continuous feedback. This practice attempts to compensate for the scarcity of resources, that is, clinical placement supervisors and patients. It is also anticipated to provide learners with a continuous monitoring and learning gap analysis tool for their clinical skills. The project goals are consistency in learning through feedback and reflection, more clinically competent trainees, improvement in all health indices aligned with the SDG 3, improvement in education system aligned with SDG 4. What did we try? So a hard copy reflective portfolio was designed and validated. The portfolio incorporated a mini clinical evaluation exercise, direct observation of procedural skills, and reflection sections. Workshops were organized separately for the stakeholders, the managers, the faculty, and the students. The rationale of the reflection was emphasized. Students were given examples of reflective writing. The portfolio was then implemented amongst the undergraduate medical students of years 4, 5, 6 of their clinical clerkship. A survey questionnaire was introduced to explore how the undergraduate students perceived the educational value of the reflective portfolio and its impact on deep information processing for undergraduate medical students. Descriptive data analysis of the survey findings was performed. The results of the analysis objectives of using the portfolio precise to most of the students. They believe using a reflective portfolio will help them identify their weaknesses in areas where their knowledge is good. Utilizing a portfolio enables them to relate to different courses, improve professional skills, increase motivation, and identify their weaknesses. However, it did not affect their self-esteem or help them develop their critical thinking. The portfolio would improve the learning value if used as a formative assessment, as feedback is helpful. Nevertheless, it takes time to complete. They agreed that the current portfolio's content is user-friendly, but the portfolio booklet itself is too bulky to carry during placements. The use of a mobile portfolio application was suggested. Our short-term outcomes were attained, whereby we could ensure that there was consistency in learning, there was regular monitoring of longitudinal clinical skills. We somehow did bridge the gap and compensate for the scarcity of supervisors at the clinical placement. We could compensate for the student-patient ratio, improvement of the students through their reflection, and there was continuous learning through feedback. We plan as next steps that during the year 2, we would have a potential transition to mobile application and strategies for project sustainability. Thank you.
ठीक है